And I am a family nurse practitioner student at Maryville University. Today, I will be doing a head-to-toe assessment on my friend Jamie. Prior to this, she emptied her bladder and redressed in a gown, and we obtained her vital signs, her height and weight, and her distance vision using the Snellen chart. I will begin this assessment by washing my hands and inspection of her head. As I inspect her head, I see that it's midline, it's upright and still, and it's atraumatic and normal cephalic. I'm looking at her face for symmetry. I see that there's no edema, no redness, no rashes or lesions present. I'll palpate her scalp, noting that it's free, moves freely across the skull. There's no masses or edema present, no lesions present. And as I palpate her hair, I see that it is soft, silky, and clean. There's no signs of alopecia. Moving down her face, I look at her face and see that it's tan. Facial features are symmetrical. No edema is present in her face. I'll palpate the frontal sinuses and the maxillary sinuses. I'm looking for edema. I'm looking for any tenderness as I palpate. Okay. I'll move down to her temporal mandibular joint. Open and close, side to side. Any locking or pain? Okay. I'm looking for locking, any pain, any crepitus, any limited movement, and none is present. Next, we'll look at her eyes. Wait. Next, we're going to do some cranial nerves. I'll ask her to make some expressions of her face, and I'll be assessing for symmetry. Wrinkle your forehead, okay, and squeeze your eyes shut. And your mouth, I want you to grimace and smile and show me your teeth. Okay, now poke out your cheeks. Okay, stick out your tongue. Okay, from left to right with your tongue, up and down. Okay, now you'll feel, I'm going to apply some resistance while you push out. Okay, and the other side. Okay, I was assessing cranial nerve 7 and 12, and they are intact. Next, I will assess cranial nerve 5. By applying sensation to the 3 branches of the trigeminal nerve and asking her if she feels the sensation. Yes. Okay. I'll assess bilaterally. Okay. Yes. Okay. Okay. Yes. And there. Yes. Okay. Cranial nerve 5 is intact. Next, I'll look at her eyes. As I look at her eyes, I'm looking at her eyebrows, her eyelids, her eyelashes. I'm looking for symmetry of hair distribution. And her eyebrows, hair is distributed evenly. Her eyelashes, the lashes extend outward, and her eyelids slightly cover her eye, the iris of her eye, but there is no ptosis present. I'm also looking for any edema, any masses in her lesions of her eyelids. I'm looking at the conjunctiva to see if it's pink. Her sclera is white. Her irises are green bilaterally, and her pupils are round. No masses are present. No exudate is present. I will palpate her lacrimal glands, looking for any exudate or excessive tearing, and there is none present. Next, I will assess her peripheral vision. By standing in front of her, I will ask her to cover her right eye. I will cover my left eye, and she will tell me when she sees my fingers in her periphery. Okay? Okay. And the other eye? Yes. Okay. And next we'll move on to accommodation. This is assessed by asking her to focus on a place on the wall and then at my pen, and I will assess the constriction of her pupils as she focuses on my pen. Okay, at the wall, and now my pen. And one more time to assess bilaterally. And again, okay, thank you. Now I'll look at direct and consensual pupillary responses of her pupils. By shining the light directly in the pupil, I'm assessing direct, and consensual is the opposite eye. And again on the other side. Okay. And the cover-uncover test is next. I'll have her cover one eye, and I will watch the other eye for any movements. Okay, there's no movement there. Okay, no movement there. Nystagmus is negative. Next, we'll go through the EOMs. That's the extraocular eye movements, testing cranial nerve 3, 4, and 6. I will just ask her to follow my pen light through the 6 cardinal fields of gaze. Okay. EOMs are intact, meaning that cranial nerves 3, 4, and 6 are intact. Next, we'll move on to her ears. I'm looking at the oracles of her ears. I'm looking for symmetry. I'm looking for any edema, any lesions on her ears, any signs of inflammation or foreign body. I see that the oracle of her ear bilaterally aligns with the outer canthus of her eyes. And next, I'll palpate the oracle of her ear, assessing for any tenderness, any swelling, any nodules. Does that hurt when I palpate your ears? The next assessment will be of her inner ear canal and her tympanic membrane. Using the otoscope on the left ear, I will assess using the left hand, pulling the oracle back and up. I see that her ear canal is pink. There's no redness, no edema. Her tympanic membrane is purely gray. There's no bulging, and her membrane is intact. Moving to the right ear, I'll do the same thing. Pulling back and up on the oracle with the otoscope in the right hand to assess the right ear. I see that her ear canal is pink. There's no edema, no exudate present. Her tympanic membrane is pearly gray and intact, and no bulging present. Next, I'll assess her hearing, or the acoustic cranial nerve 8, by standing behind her and whispering a word that she will simply repeat. Red. White. Okay. Next, we'll assess her hearing using the Weber test. This is where I'll place a vibrating tuning fork on the center of her head and asking her if she hears it bilaterally or unilaterally. Okay, good. And the Ryan test will be assessed by placing the vibrating tuning fork on her mastoid process, assessing bone conduction. She will tell me when she no longer hears it. I will move it around to her ear, and she will again tell me when that stops, and I will assess the time. Okay, bone conduction. And air conduction. Okay, that is assessed bilaterally, and air conduction should exceed bone conduction by 2 times. And her cranial nerve 8 is intact. Okay, next I'll move to her nose. I'm looking at her nose. I see that her nose is midline. There's no edema present, no redness present, no drainage present. I'll use the otoscope's light to look at her mucous membranes. They are pink. Turbinates are present and non-edematous. Her septum is midline. No perforation is noted. No redness is noted. There's no nodules or masses present in her nose. Next, I'll ask her to assess patency of her nares by just simply closing one nares and blowing out the other. Okay, and the other side. Okay, good deal. Next, we'll move on to her mouth. I see that her lips are pink. There's no fissures or lesions present. I have her open her mouth. Looking at the buccal mucosa, I see that it's pink and moist and glistening. Her teeth are ivory, all are present. Her gums are tight at the teeth, at the gum line. There's no edema or lesions noted to her gums. The hard palate is consistent with the soft palate. Next, we'll assess cranial nerve 9 and 10. I'll ask her to say I will examine the posterior pharynx, and as she says the soft palate will rise, and I will assess for symmetry. Okay, Okay, the uvula is midline. Her soft palate rises symmetrically, and her posterior pharynx is pink, and there's no drainage noted. Also, I will need to check her gag reflex. Okay. Cranial nerve 9 and 10 are intact. Okay, so also in her mouth, I need to assess her tongue. I'm going to look at her tongue and see that it is slightly rough, but it is pink and moist. There are no lesions noted on the dorsal aspect or the lateral aspect of her tongue. Now raise your tongue for me. And on the ventral surface of her tongue, it is shiny and no lesions are noted there. Her frenulum is present and there's no limitation of movement. Moving down her body, we'll go to her neck and we'll assess for symmetry of her musculature. And I see that her musculature is symmetrical. Her trachea is midline. I assess that by placing my thumbs bilaterally at the base of the sternocleidomastoid. There's no tugging present on her trachea. I assess the thyroid gland and see that it is smooth and Have you swallowed? Okay. Any tenderness with that? Okay. No border present, no tenderness present. Next, I'll move to her lymph nodes, starting at the occipital lymph nodes, post-auricle, pre-auricle, tonsillar, submandibular, submental, anterior cervical chain, the posterior cervical chain, deep cervical. Turn your head towards me. Okay, and the opposite side. Okay, thank you. And supraclavicular, infraclavicular, and axillary. Raise your hands. Okay, good job. Thank you. Next, we'll move down to her. Oh, I need to auscultate. I need to palpate her carotid arteries, and they are 2 plus bilateral, and I need to auscultate. Using the bellow of my stethoscope, I'll auscultate each carotid and ask her to hold her breath as I auscultate. Okay, and one more time. Okay, and now I'm going to auscultate the thyroid gland for bruit. Okay, my auscultation, I'm assessing for bruits, and they are not present, carotid or thyroid gland. Next, we'll move down to her extremities, upper extremities. Again, looking at her skin, seeing that it is tan. There's no deformities noted, no edema noted. I see that length is symmetrical, her musculature is symmetrical, her nail beds are pink, there's no cyanosis, no clubbing noted. Her capillary refill is 3 seconds. Her nail beds are hard and intact. Brachial pulses and radial pulses are 2 plus bilateral. Okay, if you'll turn around and we'll assess your back. Okay, I'll start with inspection of her back. I'm looking for symmetry of her musculature, of her bony structures, and I see, look down for me please. I see that her cervical spine is concave, her lumbar spine is concave, and her thoracic spine is convex. I will begin palpation with tactile fremitus. Go ahead and say 99.
99.
Okay.
99.
Okay.
99.
Okay. I'm also going to palpate for any tenderness over her bony landmarks, over the vertebrae, and the lung fields. Any tenderness?
No.
Okay. Okay. Next, I'll do her thoracic expansion as I place my hands on the 10th level of her ribs and asking her to take a deep breath. I will assess the movement of my hand and look for symmetry. Okay, big deep breath. Okay, and one more time. Now I will assess percussing out all the lung fields systematically from top to bottom. I expect to hear resonance. Okay, raise your hands for me. And resonance is heard throughout. Next, I will assess her diaphragmatic excursion, and I'll do this by percussing as she holds her breath. So I'll ask her to take a deep breath, and I will percuss down the clavicular line, assessing from when resonance changes to dullness. Okay, you ready? Okay. Okay, and breathe. Okay. And now exhale and hold it. Okay, assessing up the clavicular line. Okay. Then I would measure that in centimeters, and I should expect the diaphragmatic excursion to be between 3 and 5 centimeters. Next, I'll auscultate. the lung fields. I'll be assessing for any rales, the presence of bronchi or wheezes. Vesicular breath sounds are heard throughout. There's no rales, bronchi, or wheezes auscultated. Okay. I also need to percuss over the costovertebral area, just assessing using the ulnar aspect of my hand, just assessing for any pain over the kidneys as I percuss. Okay. Okay. Good. Let me take this off. Okay. And auscultated, we've percussed, and we've palpated. I'll have you turn around, and we'll do the anterior chest. With the anterior chest, I will again start with inspection, looking at musculature, looking at her landmarks. I see no edema, no lesions. Her skin is tan. And then I will move to palpation, palpating over the precordium, looking for any thrills or heaves, and over the apical pulse, and again for tactile fremetus. 99. Okay.
99.
And tactile fremetus is present throughout. Next, I'll auscultate her lung fields. Okay. And I also need to percuss her lung fields on the anterior side of her chest. And I've done laterally. Next, I'll auscultate her heart sounds using the belted stethoscope. I'm going to start on the right side of her sternum at the second intercostal space. This is the aortic area. And then I'll move to the left sternal border to the pulmonic area, second intercostal space. The third intercostal space of the left sternal border at Erb's point. The fourth intercostal space at the left sternal border at the tricuspid area. And the fifth intercostal space, midclavicular, at the mitral area. As I assess those areas, I'm listening for S1 and S2, which are present. I'm also listening to see if there's a presence of S3 or S4, any gallops, any rubs, or murmurs, and none of those are present. Okay, now we'll start with your abdomen. Go ahead, lay down for me. Assessment of the abdomen begins with inspection. I'm looking at the contour of her abdomen. I'm looking for any pulsations, any movement of her abdomen. I see that her abdomen is flat. There's no pulsations or movement noted. And next, I will start with the auscultation of the vowel sounds. Vowel sounds are present in all four quadrants. And I will use the bell of my stethoscope to assess the arteries for any bruits. I will start with the aorta, the renal, the iliac, and the femoral in the upper groin. And no bruits are present. Next, I'll move to percussion. I expect the abdomen to be tympanic. And then I will percuss for the borders of the liver and the spleen. The liver is on the right side. I will start at the midclavicular line, percussing upwards until I find the tympany changes to dullness. And then as it changes to dullness, I will start at the third midclavicular line, percussing downward until I find dullness. The liver should be 4 to 8 centimeters. And on the right side, I will percuss for the splenic borders, starting in the mid-axillary area of the abdomen, assessing for tympany to change to dullness. And then up, assessing down, expecting my pancreas to be at the level of the 6th and 9th rib. Next, I will palpate the abdomen, just slightly palpating for any masses, any tenderness, also palpating the muscular tone of her abdomen, and then I will move on to deep palpation, assessing for the lower liver border. Okay, take a deep breath. Okay, and the lower splenic border, take a deep breath. Okay. And I will also palpate for her kidneys, and I will ask her to take a deep breath as I palpate. Take a deep breath. Okay, and on the other side. Okay. Okay, and then I will assess in the mid-abdomen, assess for any pulsations, and none are present. Next, we'll move to her feet and legs. I'm looking for symmetry of her feet and legs. I'm looking at her skin for any rashes, to see what her skin tone is, if there's any cyanosis, any edema, any deformities, any joint swelling. Then I'll palpate her limbs, looking for any tenderness, any limit of movement, any lesions, and her pulses, popliteal pulses, dorsal pedis pulses, posttibial pulses, and all are 2+ bilateral. Next, we'll move to her musculoskeletal system, starting with reflexes. Okay, and that's one. Okay. Okay. And feet. And again. And Achilles. Okay, and strength, I've already assessed her shoulder strength and her sternocleidomastoid strength. I'll start with her hands, just asking her to push and pull against my resistance. Push, okay, arms up, push, and pull, and push, and pull, and push, and push. Okay, and that concludes my assessment. Thank you.